HIV positive than New York City per capita. So we were just dealing with all kinds of things. And so they said, well, we want to do a pilot study just to make sure that it's safe. Because we were training outreach workers. We were training anybody that wanted to, like I said, anybody that wanted to train. But we were specifically training those people that were in the trenches, direct patient care, outreach workers, high school graduates, GEDs, no GEDs. We were training them. And we were in a 5-year pilot study, probably the longest pilot study known to God and man. You normally don't do a 5-year of anything when it comes to research, unless it's a longitudinal thing, and then they're not asking for a change of legislation. So we had a 5-year study. We proved that it was safe. There were no incidents. The American Acupuncture Council, which is where acupuncturists and people like myself, that's an acupuncture detox specialist, have had insurance for over 35 years now. Not one incident with someone that was trained in the Lincoln 5-point protocol model. We have documentation from them that says that. So it's safe and it's easy to learn. We are not acupuncturists. We're not. We are behavioral health individuals. We're trying to help people change their behavior. That's what we're doing. So the difference between what we're doing and what an acupuncturist does, which has been our selling point in the state of Connecticut, is that acupuncturists are not trained in behavioral health. They have no clue what to do with an addict. They have no clue what to do with somebody that has a co-occurring disorder with psychiatric disorders. They don't have any idea what to do with that. That's not their training. And so we're not in competition with acupuncturists. We never have been. We don't call ourselves acupuncturists. We call ourselves ADSs. And so because we approached it in that kind of way, the state legislatures said, okay, do this. We, at that time, this woman was the chair of Health and Human Services. We trained her to do acupuncture. She was our biggest advocate. So the thing to do, as we all know, before you even have the conversation, let us needle you. Let us put magnets in your ears. Let you experience it, and then let's have this conversation. We have detox individuals off of everything. I've detoxed individuals off of benzodiazepines, which more times than not, they will tell you it's going to take, 3 to 4 months time, 6 weeks to taper them off of benzodiazepines. We've tapered them off of alcohol. We've gotten them off of heroin. We've gotten them off of oxys. We've gotten them off of any substance that somebody could be addicted to. We've integrated it into mental health settings for individuals that for years and years and years may have had schizophrenia, schizoaffective disorders, things like that, that for the first time found a sense of peace. They could manage their medication, and some of them even began to ask for less. I worked in one of the earlier studies by this psychologist named Art Margolin. He was out of Yale, and he was doing comparing the 5-point protocol to what they call sham points. But there's no such thing as a sham point because we're human beings. Anytime you touch us, there's a chemical reaction no matter what. But they tried to do that with methadone clients, right? And basically what the outcome was, they were like, well, people were asking for less methadone. People were saying, let me do my acupuncture before you medicate me. And then they tried that, and then people didn't want the methadone because they were okay. They were feeling fine. We gave them some tea, and they were like, I don't want the methadone. But when you're messing with somebody's cash cow, That's a problem. So we've done, I think we always say that if you're going to do any type of research with acupuncture, to do your evidence based practice and then do evidence based practice and then add acupuncture. And whatever you're doing, do what you do, and then do what you do, and then add the acupuncture piece. And Dr. Kinsu Carter has done a lot of research in doing that. You can look him up as well. And what we found is that when you add acupuncture, it changes everything. It changes everything. And the beautiful thing is that it's always, always, always an adjunct to treatment. It is never a standalone treatment. We know that people that have an addictive lifestyle, they need some help. Like that man said, that, I'm in pain. I knew I was just medicating my pain. And so we have to have tools to give people voice to their life experience. And more times than not, Black and brown people are not given a voice to their life experiences. Who wants to hear about your oppression? They want to call it that we're volunteer, what are they calling us? The voluntarily unpaid laborers for 500 years or 350 years of chattel slavery. That's insane. That's insane. And we constantly are under bombardment. So we can't say that we have post-traumatic stress disorder. We do not. Because in order for you to be diagnosed with a post-trauma, you have to be divorced from the experience, the person, all of that, for no less than 6 months. I don't know a Black person in America that isn't assaulted every day. Turn on the news. You're assaulted every day. So you're assaulted every time you go into a store or you want to rent an apartment or buy a house. You go try to buy a car. The interest rate for Chad is 5%. The interest rate for, Sundiata is 10%. So all of those things are assaults. And so for Black and brown and other indigenous people, we have never been removed from the assault. But we have to know that we can heal ourselves. But we have to decide that we're going to take personal responsibility for that. We have all the tools that we need in our community to heal ourselves. And just like the brother said, look, I'll train you to do the ear acupuncture. You're not an acupuncturist. No, you can't hang a shingle. You can't do any of that. But if your family members are saying, please, let me experience this, there's nothing anybody can do. It's just you have a skill. You can learn the skill off of YouTube. You have a skill. Heal your family. Take a box of magnets. We know now that they're doing research on magnet therapy. Big time research at Yale on magnet therapy. He's putting people in these rooms and putting these giant magnets like all around them and see if it changes their mood, to a positive mood that makes them less psychotic or whatever. But we know that magnets, because our body is currents, we aren't moving, living human beings. We have meridians or we have currents, whether they're your nervous system current, whether they're your circulatory system, whether they're your lymphatic system, whether they're your fascia system. All of that is so interrelated and it's moving and it's alive. So when you put the magnets on someone's ears, it has a calming effect. We had a clinic in New Haven that for whatever, we trained their medical director, first of all. And so when we trained the medical director and she went over there from our clinic to their facility. And she had people trained, and then the administrative bureaucracy got in the way for 2.5 years, was saying, well, you need this, well, we have to redo plumbing, we have to do this. It's like, no, all that isn't necessary. And so for what did they do for 2.5 years? They did magnets. Every client that came in, there's no regulations, there's nothing for magnets, right? So for they before their groups, they would give people magnets. After groups, we give people magnets or vicarious seeds to stimulate points. When Matula Shakur was talking about they would stand there with fingers in people's ears, this is what they were doing, okay? They were massaging the point, and it has a calming effect. So I am, at this point, I am the director of training for the National Acupuncture Detox Association. So we have been in a serious transition. It's almost like the spook was set by the door. I've been affiliated with NADA, like I say, since 1991. In 1996, we instituted the ear acupuncture in the clinic where I worked. It took us from 96 until 2009, and I developed, along with Dr. Smith, a training program for physicians and advanced practice clinicians. My thought, because I kept pushing the envelope. So I don't know. I went to a conference, I came back, and I showed this film called Unimagined Bridges, right? And it's all about acupuncture interventions during traumatic experiences, like a tsunami. They showed people needling folks in the ears at the tsunami, at the California fires, at the tornado site in Joplin, Missouri, New Orleans at Katrina, and they're still doing these things, right? And so it was like the medical director, who I'd been working with for years, turns to me and says, okay, I think I want my physicians trained. I was like, really? Felt like I had hit pay dirt. And at the same time, the woman who was the executive director at the clinic, she was in charge of the psychology pre-docs. The physician was in charge of the residents and what they call the postdoc fellows. And so your postdoctoral fellows are those individuals that are fully licensed physicians, but now want a specialty in addiction. And so they would come to the clinic, and I would train them to do triage, which is an emergency assessment of addiction and co-occurring disorders. And then, that was just one of the things that they would have to do in order for them to learn. And she was in charge of the pre and postdoc psychologists. And so she said, well, I want the psychologists trained too. And after the second year that we did this, we had Dr. Carter come to talk directly to physicians. We had Dr. Teo Carlos Strawn come to talk directly to the physicians. And Dr. Carlos Strawn was in the first class that we had trained at Yale. And so the Yale University School of Medicine now had incorporated, after 2011, it was incorporated as part of the curriculum for for the doctoral fellows, which was the first in the country for them to make it a part of the training. So I just say to folks, just continue to persevere. Just stay out there, put it out there, get your allies, get as many allies as you can in order to change the law. We can change things here, even in the state of Washington. Now they say they're nurses and doctors, physicians. And for one point in time, you had to be an acupuncturist. Now it's changed, and I'm not sure how much more it's changed. I can't quite get a good read on it from anybody. They've yo-yoed me around a few departments already, and I'm just keeping because I said I wanted to move to the state of Washington, and these are my credentials. And so they're like, well, Miss, it's going to take us a while because you have so many credentials, and there's a number of departments that have to look at, your nursing degree. They have to look at your marriage and family therapy. They have to look at your licensure in addictions, and this certification in alcohol and drugs. It's going to take a minute. I said, okay, fine. But all I say is, this is the people's medicine. They are not, that is no exaggeration. We say it's an intervention for behavioral health. Everything we do is behavior oriented. So it's like, this is what we do. And so it would be, for me, I'm still in the same place I was in 1991. If this will change the life and impact 0.1% of that population, I am all in, because it could be my mother, father, sister, brother, cousin that's part of that 0.1% that their life would be changed forever. And it's like they say, when we're in our training, we trained folks to say, when people will say, oh, thank you for making me feel better. And we make sure that they say to them, I had nothing to do with you feeling better. The good feeling was always inside of you. I just stimulated some points to bring that out in you. Do you know how empowering that is for somebody that was seen as an untouchable? Addicts and people with mental health disorders are seen as untouchables. It's like, but for me to touch their ear, just gently touch their ear and needle them, is a validating space for them to be in. And when you touch the ear and then you put the needles in, it makes all the difference in their world. And then it prepares them for therapy. It prepares them for an intervention. It prepares them to go to a 12-step meeting. It prepares them to talk to the judge. It prepares them to do those things that create that anxiety. And it does this. When you're in your active addiction, you get the stimulus from all those past traumas, and then you get your response. And your response is alcohol, drugs, workaholism, sex, this, that, the other thing, all those unhealthy things, right? So with the acupuncture, it continues to widen the space, which is what we want in therapy. We want you to have, because you always, always, always are going to have this stimuli. What I need as a therapist is to give you some time and space so you can think about how do you want to react to this? And what do you choose to have your consequences be? And hopefully, by the time you go from your stimulus to your response, it'll be a healthy one. And if it's not, it'll at least be minimally, the response will be what you know that you have to accept. No harm, no foul. If you choose that path and you know that path is going to take you to jail, don't get angry with anybody. Don't be acting out. Don't go slap nobody, because that's the choice you made, right? And if you did make that choice, that's okay too. Get right back. Come right back. And let's work on it again. Let's work on it again. So that's what this is about. And so spread the word. Tell people to come look at the film and have our discussion Monday. We're going to be doing this again Monday at 11 o'clock. We're going to be having the training starts Thursday, the 15th. You can go, we have a flyer. All the information for you to sign up for the training is on the flyer. You just have to be a caring human being. Show up. Let's do this thing. We're going to have a group of wonderful practitioners that are going to be available to do this. Dr. Sharon Jennings Rojas, she's a doctor of acupuncture medicine. She is one of the the deans at the Maryland Institute for Acupuncture. It's part of the University of Maryland system. She's also an herbologist. So she's taken what we're calling the Not a Sleep Mix Tea 2.0. She's developed the 2.0 tea. So she's going to be bringing both teas with her and all of her expertise. We have Dr. Yvette Miller, who is a hematologist, and she is the director of, she's one of the medical directors for the American Red Cross. And she's bringing her knowledge and her fever for educating us about the healthcare system and how we can become more empowered in that system and how the use of air acupuncture enhances that. Nate Hurst, who will be here to talk about the criminal justice side of it, as well as that of being a social worker and talking about using it in clinical settings. And I will be here as a hands-on person, to lend whatever knowledge and information that I can that I can lend as a marriage and family therapist, as a person that's an addiction specialist, and the things that I do. We will be Zooming in Dr. Kinsu Carter to give greetings and also to do a training, one of the training modules. He is he has a credentialing in acupuncture and Eastern traditional Chinese medicine. And he is a physician for the VA. So he's been working with veterans and battlefield acupuncture and can talk about the difference in that. And he's done a great deal of research. And then Dr. Warren Leggett, who has he's a doctor of sociology, and he'll also talk about the criminal justice aspect of it and the social implications of NADA and what we do. So I am, we're gonna, I don't know whoever can get here on Thursday, please come. Just please come. And it is going to be dynamic. And we're going to focus, it'll be for us, by us, and to just talk about the how do we heal ourselves, and to give you this just very simple intervention for you to use in your private space. And we want you to be an advocate for change so that we can have a very broad law in the state of Washington. They're willing to listen now to any intervention that is going to help this opiate crisis, because just like in the film, they said it hadn't hit the suburbs. So they weren't really concerned about what was going on. But now it's their children. Before, it was our children, our babies. And when that brother Matula Shakur came in and said, hey, look, there is a different way to do this. We are not going to allow methadone to be in this clinic, to be in this community. We know the devastation. There's documents about the devastation of methadone clinics in Black and brown communities, because that's where they go. And no, it does not constitute that you're not going to have inappropriate behaviors, because it brings inappropriate behavior to the community and it will devastate the community. So, any questions? As you see, I have such passion for what I'm doing. I just yes.
We're just so appreciative for you. It's just interesting how everything works out. I just keep thinking about that, how the intersections happen. And we are definitely honored and privileged to have you, in our local community, sharing your gifts and your wisdom and your passion and love for our people at the end of the day. And so this one is one that, you know, the opportunity have presented itself within the time constraints. And so if we can plant the seed, we'll push as far as we can to get as many people to come out, but we'll figure it out. Like I said, I had my younger cousin, he passed in 2021, the fentanyl, niece that they found her shot to death, and she had been, out in the streets for many years, and or a few years since her father had passed when she was like 14. So it's very close to home, just to have them at least have an opportunity to experience something that could give them some relief. Um, I think we just have to get it started with people and one person tell another person and so on and so forth. So we'll 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 get it out there to as many stakeholders as we can. And people are serious. I'm striving to clear my calendar so I can participate. So
Excellent.
I think this is very, just to be a resource to your own, like you said, family, your own children, right? Because there's different things that, they may go through. So,
Yeah. I'm
yeah.
telling you, it's if we can begin to educate our generations around self-care and getting them to understand that self-care is self-love. And so for my grandchildren, the ones that are here, the ones that are in DC, the ones that are in New Haven, when we get together, the children know that they know they can ask for magnets when if they're feeling like, Mima. I mean, they're young. The oldest is soon to be 18, but they range from a year old to 18 and all points in between. But, we've gathered, I've taught them how to do tapping, right? One really gets into tapping because he's a fidgeter. He's fidgety anyway, you know. So he really likes that. But he'll ask for magnets. The kids know to just breathe. They hear me say that to them all the time. Okay, we're gonna breathe. Just breathe. And then you can tell me once you calm down, let's just breathe and then let's talk about it. But if we can begin to educate in the home, those kind of things, send your children to school with magnets because the system is not designed for our children. Our children don't do well in a purely didactic setting. They need to be moving, they need to be doing those things. But this is our reality unless we can go to an Afrocentric educational space. But do the magnets. I mean, we had people getting ready to take those Ph.D. and all those other licensure exams. They left with magnets in their ears and the deep breathing technique in order for them to oxygenate their brain and stimulate their memories. So we teach that to professional people. Why not have the opportunity to teach that to our children, to our families, to use it ourselves? We have to do that. And so that's my that's my energy and I'm sticking to it. Any other questions or comments before we close for the evening? And no, don't. Me me too. Well, I would just encourage you to reach out to your organization that's in Renton. Please feel free to reach out to them and um, use that flyer, which has the QR code on there. It gives you the instructions on how to sign up. You have to sign up through the National Acupuncture Detox site. Um, uh, so that we have you in the system so that once we finish the training, you can basically automatically get your certificate of completion. So those are the smaller things. If there's people that you know that have further questions, please invite them to come to the second discussion and viewing on Monday at 11. We did that like during the middle of the day, just in case, people are independent practitioners and, or they didn't want to take up their weekend or whatever, that they can plan to see it. Also give them my contact information. I think that is also on that QR code, but I want you to write it down. I'm going to give it to you. So just write this down, 203 915 see me, I'll put it in the chat. Let's see. 203-915-6301. And yes, so you can text or call, and that's my first name, Katurah. And God willing, let's just pack the house. I got enough, there's enough of us that will max out around 30, 35 people. But if 40 people show up, we are definitely training them. At the Banu Center?
Banu Community Home.
The Banu Community Home? It's
It's a terrace
it's where?
on Yesler, I believe.
Is White King, are you still on?
Yeah, if you register, you'll get the information on the location and everything. My link is, but if you register, well, no, yeah, the registration info is in the email. Yeah. Okay. All right. I'm gonna sign off.
$615. Um,
I think we have to figure that out like
yeah.
quick. But
Yeah.
yeah.
So I can, I'll talk to you about stay in touch with Africa Town and Joaquin to see how we can make it happen.
Okay. All right.
This Monday is the second film viewing and then the training will start on Thursday morning at 9 a.m.
All right. I'm signing off. I'll
Okay.
be in touch. Thank you.
Peace. Thank you so much.
Yep. This is fab.
Okay.
Thank you.
So, Dr. Jackson, I'm hoping and praying that we can, you can work it out some kind of way. You just need to do it Thursday, Friday, Monday, Tuesday of next week. Creative. All right. Thank you so much.
Thank
Appreciate it. And did you write those recommendations in the chat of the radio stations and?
Yeah, Tony Bennett, Rainer Avenue, and Triana. So I'm on it. All right, so yeah, thank you. I appreciate it, and definitely will look forward to connecting with you in the future.
All right, see you in person on Thursday. All right, best things.